Dr. David Rakel did a fantastic job of presenting at one of the senior days that are sponsored by St. Mary's Foundation. Dr. Rakel teaches people how to maximize their potential for their body in later life by just observing good nutritional habits and developing good nutritional habits. But he does so with a great sense of humor, and there's a great spirit about Dr. David Rakel. So we try to put together these presentations for seniors because we want them to maximize their potential for the life that's been entrusted to their care. Also at St. Mary's Foundation, we try to maximize the potential for people in their generosity. We think it's a very serious responsibility when people entrust with us something that's been entrusted to their care first. So when they contribute dollars or they contribute time, a piece of their life, and they contribute time to our volunteer services, it's very important that we use those gifts and that we use those financial contributions to maximize the potential for the people that we serve. And so I would encourage you to please consider a gift to St. Mary's in your will, or maybe consider a charitable gift annuity, a gift that pays you a very generous income for life. A 75-year-old can earn a guaranteed 7.1% interest on an annual contribution that will someday serve people who are at their most vulnerable point in their lives. They're sick and they're in need of healing. And that can happen for children. It could happen for heart patients or cancer patients. It could happen for people who need end-of-life care. So we encourage you to be generous, and we hope you enjoy this presentation by Dr. David Rakel, who really does a wonderful job of it comes through in his personality that he does have this great spirit of appreciation for what's been entrusted to him, this great knowledge, this wealth of knowledge, and you get a real sense that he enjoys sharing it with the people that he presents to. So we hope you enjoy it. Thank you.
My name's Dave. I'm from a different culture up north, Madison, Wisconsin. And it's truly a pleasure to be with you here today to really celebrate life. I turned 40 a couple of years ago, and my son and I, we were sitting down at my birthday dinner, and we went around and we said what we were thankful for. And my 10-year-old son said, "Thanks God for helping Dad make it this far." You know, I was only 40, so I think we should do that at every birthday, just to really appreciate the joy of our present moment. We're going to talk a little bit more about the mind, body, spirit piece this afternoon. This morning's going to be more practical information on how nutrition can influence our health in a positive way. So I picked 3 areas that many people, both men and women, have an interest in, and that's how nutrition can have a positive influence on prostate cancer, breast cancer, and osteoarthritis. I was in private practice in this little town called Driggs, Idaho. It's right at the base of the Teton Mountains. Anybody ever been there? All right. right across from Jackson, Wyoming. Jackson, Wyoming's on the other side. Grand Teton National Park is just up the road. I wanted to be an all-in-one doctor, you know. If there was one doctor that could serve a community, I wanted to be it. So I went to this little town. I was one of 2 doctors. We had a nurse practitioner and a physician's assistant. And we had a little 14-bed hospital, and I practiced womb-to-tomb medicine. And that was such an educational experience because you realize how complex health is. That it's much more than just taking a pill. That it's a very dynamic process based on biopsychosocial spiritual influences that is unique to each and every one of us. My patients are my best educators. Was this patient, Stan. He was only one individual, but he taught me the importance of looking at nutrition. Stan had localized adenocarcinoma of the prostate, and he was a tough guy, Idaho rancher, and the urologist said, "Well, Stan, we got to take out your prostate." And I went in, I felt that prostate, and I'm sorry if that causes stress to any of you guys. I went in and checked his prostate, and I felt this nodule. It was a pretty good-sized nodule. And Stan said, the heck with that. I'm going to make some nutritional changes. I'm going to take some of these nutritional supplements, and I'm going to beat this thing. And he did not, I wouldn't recommend this, but he did not go with the urologist's advice. He took it upon himself to make changes in his nutrition. And this was a rancher in Idaho who ate mainly meat, potatoes, you know, the typical American diet. And he became this health nut. You know, this stoic rancher became this granola almost. He became a very conscious of what he was putting in his mouth. And 6 months later, I went and rechecked his prostate, and that tumor had resolved. I said, whoa, what's going on here? And I started to think, okay, what is it? Is it his nutrition? Is it the supplements that he's taking? Or did this give his sense of being purpose? You know, this was the way he took control of his disease. It empowered him to make choices that he could do something to facilitate his future. I don't know which one it was, but I bet it was a combination of all three of those. Today, let's explore the nutritional piece a little bit more. This is an interesting study where they did autopsies of men who died of something else other than prostate cancer. And they looked at a number of different age groups, and they biopsied their prostate, and they looked for cancer cells in the prostate. These are men who died of something other than prostate cancer, but they just wanted to see who would have prostate cancer in their prostate gland just based on autopsy results. 25% of 30-year-old men had prostate cancer cells in their prostate. Look at this. This is kind of scary. 70% of 70-year-old men had evidence of prostate cancer in their prostate glands. Now, chances are, if you're 70, there's a good chance that there's some prostate cancer cells in your prostate. Now, this challenging thing is here, when we're diagnosed with prostate, that creates fear, right? Or prostate cancer. And we feel like we have to take action, we have to do something to get rid of it. But actually what we're realizing here is that a lot of us have prostate cancer cells, but our body's able to keep it in check. Our immune system is able to fight it off to keep it in check so it doesn't become an aggressive disease and something that we might lose years from. So we're going to talk about ways that might help stack the deck in our favor. Now, I'm starting off with prostate cancer, but there's a lot of overlap here with breast cancer, that these are both hormone-sensitive diseases that have similar risk factors. Okay? This is our goal in integrative medicine, is how can we facilitate a balance for that living organism to best heal itself. Success means we need fewer medications, fewer surgeries, fewer acupuncture treatments, fewer interventions to maintain that health. Now, it's nice to have that intervention when we need it. You know, that's why it's so nice to have this new technology center coming up over here, because our technology can do so much good. But we also have to have that understanding of what we can do to empower our own health to facilitate our body's best ability to self-heal. Now let's look in cultures that really seem to be healthy and learn from them. Okinawa in Japan have the most centurions of any culture on this planet. Compared to the US, they have 80% less heart disease, 50% less colon cancer, and 25% less prostate and ovarian and breast cancer. In fact, this guy, he's 65 years old. I'm just joking. But let's look at Okinawa and see what kind of culture that they have and what type of lifestyles that they are involved with. On average, they eat 7 daily servings of fruits and vegetables a day. Their diet contains a large amount of soy, green tea, fish, and these are foods rich in omega-3 fatty acids, which we'll talk about today. They eat less dairy, less red meat, poultry, and total calories. So, you know, our buffet dishes are about this big in America. Theirs would be this big. Portion sizes are much less. They're physically active. Their lifestyles include dance, martial arts, walking, gardening. They use cars less, and they use their feet more. And they have strong spiritual connections and communities. Most of the people in Okinawa feel part of a larger whole. There's much less social isolation. And if there's a prescription for health that we'll go over today, which I didn't add, but if I could recommend a best friend, you know, That would be the most important first step in helping the body self-heal.